So when is surgery appropriate for femoral acetabular impingement syndrome, right? So first and foremost, if you're not making progress with conservative management, which is usually some sort of physical therapy and sometimes an injection, okay, and also activity modification. So staying away from things that aggravate this. The second piece is you need to have some sort of labral pathology or labral detachment, okay? The best type of labral damage to have is generally a mid-substance tear. So the type of tear actually does matter. And lastly, you don't need this, but it's present in a large majority of the surgeries that I see, is one of those cam or pincer morphologies. Okay. So if you have that morphology, just a little bit more likely probably to have labral pathology over the course of time. They want to take that down to see if they can reduce future injury to the labrum as you return back to activities. So when is surgery not appropriate for femoral acetabular impingement syndrome? So the first one is going to be severe osteoarthritis. Okay. And if you start looking through our literature, the best predictor of folks that do poorly with hip scope surgery is going to be decreased joint space, right? So if you have less than 2 millimeters of joint space, your risk of getting total hip arthroplasty increases in the future. So folks that have greater than 2 millimeters of joint space tend to do pretty well, and less than 2 millimeters, not so much. The surgeons that I work with will not do surgery on hips if they have less than 2 millimeters of joint space, which ends up being a big problem if you have a 40 or 50-year-old that has severe hip pain, have arthritis, and they're too young to get hip replacement surgery, right? So that's actually one of the things that pops into my head when I see a younger person that I'm concerned that they have some sort of hip pathology, labral pathology. I will send them to a doctor sooner rather than later, just because I want to make sure that we do get a surgery if it's needed, right? Before they get too much hip arthritis, too much joint space reduction, and they won't have a good outcome from the surgery. And then they can only at that point get a hip replacement, and they're usually a little too young for that, right? So surgery is also not appropriate when folks have labrum intrasubstance degeneration, calcification, or ossification. These things are often associated with osteoarthritis. If you have frayed or flap labral tears, so some labral tears just can't be repaired. We'll talk about that in a minute. And lastly, I went a little bit more in depth on folks who should get surgery versus physical therapy or conservative treatment in my last show episode, Evidence-Based Guide to Femoral Acetabular Impingement Syndrome. I'll leave a link in the show notes, so definitely check that out. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons. It's going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.